on to the elbow and forearm. You can absolutely use this for the elbow as well if it's easier to read, but generally the medium-sized goniometer is designed for the medium-sized joint. So I would think about this as the big joint goniometer, so shoulders and hips. I think about this as the medium joint goniometer, like elbows, forearm, wrist, and knees, and ankle. And then, of course, the small one is for your digits. So that you can mix and match these to a certain degree, but you'll find that some are easier than others. And frankly, I use this as often as I can because it's easier to read. But whatever you like. So I'll use this for the elbow, just so easier for you to see. All right, so we're going to start with elbow extension. Our axis point is going to be the lateral epicondyle. So find the anatomical testing position, which is like this, with the wrist kind of in supination. We find that cluster, that's the lateral epicondyle muscle cluster right there. And behind that, it's hard to feel on some people. I can feel that lateral epicondyle, which is right there on Chad. I'm going to find my axis. So in order to test elbow extension, we first put the person in elbow flexion as their starting position. Now, I don't care don't measure it here. This is just starting position. This is where we're going to begin from. Now we'll tell the person, please lower your hand in wrist neutral position so like that, if you don't mind. Yep, to the ground and to the floor, pointing downwards as far as you can. And hopefully most of us will be about 0 degrees if we keep our axis here, our stationary arm with the humerus, and our movable arm along with the radius. Most of us are going to be that straight 0 degrees, give or take a degree or so. If someone truly has a deficit and can only get to about there, maybe they've a bicep tendon tear or a olecranon fracture, and that's as far as he can extend. Okay, so now we're measuring everything, and we see, oh shoot, we've got 20 degrees that he has not yet achieved. How would we write that number? Negative 20. You got it. So there can be a lack of extension. We'd write that as a negative number because normal should be 0. And if he's not 0, then he's going to have a lack of extension. And for flexion, a little bit easier. Same premise. We start in extension as well as we can. Same lineup, same exact arms. Have that person go into elbow extension. I think they want you wrist neutral, not wrist supinated. Same lineup. If you lose your place in the middle of this, that's okay. It's pretty easy to find everything again. Correct yourself, and you're going to get a pretty good high score, 140 or so. It's pretty typical for most people. You can imagine, though, like me, if you have huge bulging biceps, you're going to have less of degrees of flexion because there's soft tissue in the way. Something to keep in mind. And then we'll finish with the forearms. And for this one, you'll definitely need to use a smaller goniometer. I'd suggest this one. So, supination and pronation. The key here I'll point out is a lot of people try to test it like this with the goniometer flush against the skin. No. You want it cutting into the skin. You want it bumping into the skin in like it's perpendicular to the skin. That'll be a huge point of confusion if you don't do it the right way. We're going to start with the goniometer up and down straight like this. That's going to be our starting position. Let's do pronation first. So our bony landmark, feel it on yourself right now, is the ulnar styloid. Easy to palpate on your ulna. It's the distal end of that and is poking out of the skin. We're going to find that, line up our axis there as well as we can. I know it's hard for you to see, so we'll walk around. Try to stick with that. I'll tell Chad, please bring your palm down like you're dribbling a basketball. I am going to make sure that it's like, it's like I'm chopping off his wrist here. I'm cutting into the wrist in a sense with the edge of this goniometer. I mean, please don't hurt people. But if you kind of give a haphazard, attempt at that, your angle is way off. You want that to push flush into the wrist crease there. Your stationary arm is still shooting down towards the ground, should be straight perpendicular to the floor. I think they say in line with the humerus. Is that right? I can't remember what the book says. But as long as it's shooting straight down, and then this one, of course, is gonna be pushing into your skin, we're gonna get something around, what do we have here? 82, so pretty flexible. I think the norm is 80 maybe in the book, so somewhere around there is good. Supination is just the opposite. You're trying to find along the volar aspect of the wrist now, we're finding the pisiform. That is that rock-like, bony part of, it's one of your carpals. Okay, so it's your last carpal, the one that's like directly below your pinky, and it sticks out. So we should be able to feel it pretty well, palpate that, and the book says go just proximal to the pisiform, so essentially along the wrist crease. We're gonna try to keep that lined up there. Usually you're facing your patient. It's gonna be easier to sit on a chair in front of them, but I'm trying to show you. So hopefully I got it right. We're gonna say please supinate, explain what that means. Keep our stationary arm shooting down to the ground. Our movable arm is gonna go flush against the wrist crease, and we're gonna get our number, which is gonna be somewhere around 81. The last thing I'll mention is with supination, pronation. Let's show that one more time. That axis, your center button here in the middle, is going to travel as we supinate. The important part is that your arms are in the correct position and your arms travel well, but you'll notice that axis point shifts as we go. That's okay. If you tied a string to that and then sutured it into his pisiform, that little string is going to stay the same length. It's going to be at the same angle of that axis point the whole time, even if the whole thing shifts. So that's important to remember. The key, I'd say, for this is push into the skin in order to get the right measurement.